All right, wonderful. Aloha kako. Welcome everyone. My name is James Eustace. I'm the president of the Waimea Community Association. Thank you for joining us this evening for a special event. Tonight we're hearing some important news information that's really impacting our keiki and our communities across the state and everywhere really about vaping. And we're really wonderful and grateful to have some special guests to join us this evening that are really front and center and really on the ground dealing with these issues in our communities and our schools. If you do have questions this evening, please don't hesitate to use the Facebook chat. We have allocated some time at the end of tonight's meeting to share your questions, some community questions that have been submitted ahead of time, as well as questions you might have live, and we'll share them with our guests this evening. So really, without further ado, and this is really in collaboration with Waimea Middle School, I'd like to pass this over to our Waimea Middle School principal, Janice English. Welcome, Janice.
Thank you, James. I really appreciate the time this evening and the Waimea Community Association for hosting this event, which is important for our community, for our students, and our families. About 3 years ago, Sally and I had a long conversation about what it meant to educate students and teachers and community about what vaping can do. And I hosted a little talk story with my students back then, and it was pretty effective from the feedback. I haven't been able to do that with students just because of the pandemic. And so we're asking this forum for parents to be able to have access to answers about how to best help students now and in the future to prevent, and it's really a cessation of the use of the vaping devices because it's in the schools. We know it's here and we're just trying to extinguish the behavior. On the call with me this evening is Lori Ching. She's our counseling intern, and we appreciate Patty Cook. She is a community liaison extraordinaire as well as our development director. And she and Lori worked really hard to put this evening together, and we appreciate all their support and outreach. And so I want to now turn the mic over to Sally and have her introduce her crew.
Thank you, Mrs. English. And we are really pleased to be here tonight with the Waimea Middle School parents and the Waimea community at large. I'm Sally Anchetta with the Hawaii Public Health Institute as your Hawaii Island coordinator, overseeing our Tobacco-Free Hawai'i Island Coalition. And with me tonight from our HIPHI organization is Josh Ching. He is a student at Kamehameha Schools and he's a youth council member. So he will start our evening's presentation. And then you'll hear from myself looking at a Hawaii Island perspective of the problem. And then we have Kevin Ramirez, who is our youth education and prevention program coordinator statewide. And then Amanda Fernandez is our statewide policy and advocacy director. So we're happy to be here. Thank you.
Wonderful. Thank you, Sally. Thank you, Janice. So without further ado, we're going to kick it off with Josh, and we're grateful to have you, Josh. Thank you for joining this call and being a part of this conversation for our keiki and your colleagues as well, of course. So thank you so much. We'll pass it right over to you.
Thank you. Aloha mai kako, everybody. My name is Joshua, and I'm a member of the Coalition for Tobacco-Free Hawaii's Youth Council, a program of the Hawaii Public Health Institute. Our Youth Council has been working to pass legislation to address the youth vaping epidemic for the past several years. We've come close the past couple of years, but have fallen short and need all the help that we can get. But first, let me share a little bit about the problem that we're facing. While the rate of combustible cigarettes use is at an all-time low, the problem we face is that youth use of e-cigarettes has skyrocketed, nationally increasing 135% from 2017 to 2019 alone. In 2019, the most recent data from Hawaii available, 18% of middle school students reported having used e-cigarettes in the past 30 days. That's more than 3 times the national average. For high school students in Hawaii, the rate was 31%, placing us as one of the top states for youth e-cigarette use. Some groups are impacted more than others. Over 45% of female Native Hawaiian or other Pacific Islander high school students reported having used e-cigarettes in the past 30 days, and 30% of Native Hawaiian or other Pacific Islander middle school students have done the same. We now know that e-cigarettes have many negative health impacts, in particular for youth. Nicotine harms the developing brain, impacting memory, attention, concentration, cognition, and impulse control. People that use e-cigarettes are 56% more likely to have a heart attack and 30% more likely to suffer a stroke than non-smokers. E-cigarettes aerosol has many harmful chemicals, including acetaldehyde and formaldehydes. These aldehydes can cause lung disease. People that use e-cigarettes are also 55% more likely to suffer from depression or anxiety. With the persistence of COVID-19, a study published by Stanford University on August 11th found that youth e-cigarette users were 5 times more likely to be diagnosed with COVID-19 than non-users, with youth using e-cigarettes in the past 30 days 6.8 times more likely to be diagnosed with a disease. Tobacco companies have a proven sales strategy when it comes to planting seeds for future customers. These executives have gone on record to state that, quote, the base of their business is the high school student. They know that 95% of smokers start before the age of 21. Candy-flavored tobacco products can lead to a lifelong addiction to nicotine, with 8 of 10 youth that have ever tried an e-cigarette starting with a flavored product. 97% of current youth that vape use a flavored product as well. And with more than 15,500 mostly candy flavors, they're not fooling anybody except maybe young kids. There are countless examples of e-liquids that look just like popular candy. Flavors also mask the harsh taste, making it easier to start and harder to quit. They also know that flavor means a whole lot more. They exploit our local foods and culture. How else can you explain flavors like Hawaiian sweet roll, Hawaiian pog, or Mauna Dew? While they claim in words that they're not marketing to kids, their actions speak loudly and carry a different message. But it's not just e-liquids, it's small cigars, smokeless tobacco, and menthol cigarettes too. 65% of kids who ever tried cigars started with a flavored product. Menthol cigarettes, for example, have helped to addict generations of African Americans, Filipinos, and Native Hawaiians. They are by far the most popular type of cigarettes with these populations. 78% of Native Hawaiians and Pacific Islander smokers smoke menthol cigarettes. Menthol makes it easier to start and harder to quit. To make things even worse, Native Hawaiians and Pacific Islanders are more likely to die from lung cancer than most other groups. The medical community doesn't exactly know why, but the tobacco companies know about this health disparity and keep targeting Hawaii as a menthol market. Menthol is dangerous in e-liquids too. It increases cell damage and exposes users to up to 1,600 times as much pulgon as smokers of menthol cigarettes. Pulgon has been banned as a food additive by the FDA, but it's still being used in e-liquids. And to us, the solution is simple. Join the more than 200 other states, localities, and municipalities that have banned flavored tobacco products. End the cycle that hooks kids. Say no to all flavored tobacco in Hawaii. While the federal government has restricted the sale of some flavored e-liquid pods, it doesn't include menthol and still allows the sale of all flavored e-liquids sold in bottles and disposables. In Hawaii, refillable pods and disposable e-cigarettes are the most popular among youth, so ending the sale of all flavored products is essential. Ending the sale of flavored tobacco won't solve the youth vaping epidemic on its own, but it will help prevent new keiki from starting. The Tobacco Control Act of 2009 eliminated flavors in combustible cigarettes except menthol, and declining youth rates followed, so we know it will help. To truly end the epidemic, however, we need to treat e-cigarettes like other tobacco products in Hawaii and require permitting and licensing, tax e-cigarettes like other tobacco products, and restrict online sales. One policy we know doesn't work, however, is penalizing youth who have become addicted through targeting by the industry. Let's have a quick look at each. In order for us to truly end the corporate exploitation of the tobacco industry, we also need to regulate them to curb their influence. Currently, anyone can sell e-cigarettes, so requiring permits in order to sell will allow us to accurately enforce Tobacco 21 laws. Licensing, moreover, will allow us to identify who is selling e-cigarettes and e-liquids to make taxation efficient. Overall sales of e-cigarettes are also sensitive to price changes. A 10% increase in price reduces sales of disposable e-cigarettes by approximately 12% and by about 19% for reusable e-cigarettes. The findings in the quote by Dr. Levinson are echoed by other public health leaders across the country, but let's hear it in Dr. Levinson's own words. Don't believe the unfair to the poor claims. 2 systematic reviews of all studies on the subject found that lower income smokers reap the biggest share of health and financial benefits from cigarette price increases. The reason is simple. Lower income smokers smokers are the most likely to quit when cigarette prices rise sharply. A majority of smokers are from lower incomes, but this group as a whole will still pay a smaller total share of new tax revenues than smokers with more income. In fact, tobacco taxes are the most equitable strategy to reduce smoking. They narrow disparities more than any other tobacco fighting approach. With youth being even more price sensitive, there is no reason to believe we will not see similar positive benefits from taxes on e-cigarettes that would raise the overall price. As you may know, e-cigarettes are just a click away for many youth. Hawaii schools have shared that students as young as 6th grade reported being able to buy e-cigarettes online with a debit card they can get at the corner store. We need to close this loophole. Combustible cigarettes can't be ordered online, so why should e-cigarettes? Last, youth purchase, use, or possession, or PUP laws, are not an effective approach to reducing youth tobacco use and inappropriately shift the blame for underage tobacco use from the tobacco industry and retailers to young people. We need to help youth quit, not punish them for being addicted. The industry pushes PUP legislation as a solution to redirect the blame away from their industry that makes billions of dollars addicting kids. We need to educate our lawmakers that it's counterproductive, and we need to keep the focus on regulating the industry and penalizing those that sell to youth, not punish the youth themselves. We also need to ask that some of the funds from taxing these products be used to fund programs for youth that want to quit. There are many ways that you can help: endorsements, educating a family member, and submitting testimony on a number of our different policy priorities this year, including House Bill 1570, which is going to the CPC committee soon. You can also go to Flavor Hooks Kids, hi.org for more information and to support us. Thank you.
Wonderful. Thank you, Josh. It's great to have you on the call, like I said, and offer your perspective from our keiki. It's wonderful you're doing this for your capstone as well, if I'm not mistaken. So it's fantastic for you to have you on the call here. So I'd next like to pass it over to Sally to continue this conversation. Thank you, Sally.
Thank you, James, and thank you, Josh. You live on the front lines of this vaping epidemic. So we just are really grateful to be here tonight, to be part of this larger Waimea Association, all of the North Hawaii community, to share just some insights of what's happening around the youth vaping epidemic on Hawaii Island and how we can all respond to it. So Kev, if you can give me the next slide. So terminology, as parents, we might not know what this is, and you could talk to your kids about an electronic smoking device and they look at you like, deer in headlights, because they call it something else. So whenever I do presentations with students, I ask them, what do you call it? What have you heard it called? So they call it, instead of an e-cigarette or electronic nicotine delivery system like they do at the CDC, they call it vaping or vapes or juuling, which is a terminology they got from a product. They also call it ripping and doming. Ripping meaning that's how they feel when they inhale on the device, and doming is because they feel so high from the nicotine and other chemicals, they feel like they're hitting the ceiling. So I always learn from youth how they feel about vaping by just what their language is. Next slide. So Josh shared with us our statewide rates of high school students, and we're also going to talk about middle school students, youth, but just wanted to share with you, it's much higher on the neighbor islands. So here's a slide of our high school students with the numbers in red that represent current daily use rates. Why this is significant is back in the late 90s and early 2000s, when we had the highest rates of youth smoking traditional cigarettes, these numbers were much lower. So currently we have, as of 2019, 35% of our high school students use the devices they vape on a daily basis. 56, over half of our high school students have tried it, according to the Behavior Youth Risk Survey. And next slide. But then we start looking at it at the middle school rates. So the first set of bar graphs is high school rates. And compared to the continent, at nearly 20% in 2020 of high school students vaping, we were at 35%. But then looking at the middle school rates, this is where it really gets alarming for me. The continent had about 5% of middle school students using vape devices in 2020, where we were at 20.3%. So we're 500% higher than the continent when it comes to middle school youth rates. Okay, next slide. So why do youth vape? In the beginning, when I started to talk to youth, and what they've reported is they were bored and they were doing it to be entertained and really attracted to the flavors. 8 out of 10 youth vape because of flavored products. And then to experiment, to try something new. It's an e-device, you know, anything electronic is really attractive to our kids. To fit in, it's an instantaneous bond when you go into a bathroom and you pull out a device and now everybody wants to be your friend. And then what we started hearing by 2019, which is really alarming, is it relieves stress. I need it. And then finally, also to make friends and belong. So it's a social device. It's a way to, when you think about cessation, as Miss English did, it's really creating that space where maybe I can belong to groups that don't vape. And then finally, because I can't quit. And we're hearing that over and over again, especially from 2019 on, especially upperclassmen in high school saying, I wish I never started in 7th grade because now I can't quit. And now I can't be on the, I can't do judo, I can't do sports, and I can't stop. Next slide. So who is vaping? Vaping hits every social and cultural base at high schools and middle schools. It's not just one size fits all. We have our honor students that are vaping, and they do it because they have shared with us that it helps them study better. We have heard across the board athletes that are vaping and they wish they hadn't started, including a student that had a Division I full ride scholarship for baseball. And once he posted his vaping videos on his Instagram account, that scholarship was pulled. And now we hear of elementary students across the board, across the island. We have been getting calls from elementary schools asking us to present to all of their 5th and 6th graders, and students as young as 3rd grade have been regularly vaping on campus. And why is that? Next slide. Because when these kids are on board with these flavored pods that look innocent, look fruity, look attractive, they have no idea the level of nicotine that they're inhaling in their body and rewiring their brains to be dependent on. So traditionally, a pack of cigarettes would have 20 milligrams of nicotine by the time it was burned and consumed. And then the vape devices are not nicotine per se in the same way that they were in traditional cigarettes, where they're salts and their level of nicotine is much higher. So a jewel pod traditionally would have 2 packs worth of cigarettes in it. A Fix, which is a little bit larger than a jewel pod system, would have 75 cigarettes worth in 1 pod. And kids can go through more than 1 pod a day. And then finally, a Soren, which we've seen on many of our campuses, as well as these other devices, can be filled and refilled throughout the day. But a 1 filled Soren device is equivalent to 90 cigarettes. So if we can share the next slide, I'd like to just share with parents, there might be vape devices right here at home and you didn't realize that was a vape device. So Kevin, if you could play that, please. Thank you, Kevin. And now I'll hand it over to Kevin Ramirez from our YEP program.
All right, thank you, Sally. Aloha, everyone. Thank you for having me here tonight. My name is Kevin Ramirez, and I work with Hawaii Public Health Institute. I've coordinated the 808 No Vape campaign for the last 5 years, since about 2017. And just to give you a little bit of background, the 808 No Vape campaign worked directly with students in multimedia production classes across the state of Hawaii to raise awareness about the health risks and addictiveness of vaping through student-produced video and radio PSAs. Another part of our awareness campaign, we produced Breathe Aloha 808 No Vape murals at schools around the state. And the one you see as my background is actually located at Hilo High School. A second mural on the Big Island is located at Kealakehi High School. Currently, the campaign is focused on conducting presentations on vaping prevention at schools. And most of the requests this school year, as Sally mentioned, have increasingly been from elementary schools, which is pretty disturbing. So tonight, I'll be sharing some recent news about ESDs. ESD is the technical term for vapes and e-cigarettes in Hawaii. And ESD stands for electronic smoking device. And this term covers the range of devices that can be used to vape and inhale not only nicotine, but marijuana or THC oil. And increasingly, we're finding other vapable products being introduced to the marketplace, like vitamin B or melatonin vapes. The studies and articles I will share highlight how dangerous vaping can be, particularly for teens. So I'd like to begin with this article that came out earlier this month. The headline reads, "E-cigarettes expose users to toxic metals such as arsenic and lead." And it summarizes the recent work of a researcher, Dr. Anna Marie Rule at Johns Hopkins University, who has been studying the presence of harmful metals that have been found in e-cigarettes since 2018. Her and her team have conducted studies and have found the presence of metals in e-cigarettes like arsenic, lead, nickel, and chromium. The presence of these metals has been identified in the e-liquid prior to and after coming in contact with the metal coil that is in the e-cigarette. The metals have also been detected in the saliva, the blood, and the urine of the users. And this is a huge concern because these compounds are poisonous and carcinogenic. Dr. Rule stated that the EVALI outbreak of 2019 demonstrated that ESDs are not as safe as previously believed. So a little background on the EVALI outbreak, in case you may not have heard of it. The EVALI outbreak of 2019 saw over 2,800 hospitalizations and around 65 deaths nationwide. EVALI is an acronym that stands for e-cigarette and vaping associated lung injury. So the two X-rays you see on screen illustrate or compare a healthy lung X-ray, which is on the left, versus an EVALI lung X-ray, which is on the right. And you can see that what they refer to as quote unquote ground glass opacities, which is that cloudy-like image in the lungs on the right-hand side of the screen. Now, what that is, it could range from either moisture in the lungs to inflammation or possibly even scar tissue caused by chemicals that were inhaled through vape devices. Now, many of the EVALI cases ended tragically, as in the case of the first teenager that I ever heard of dying from vaping. That's the top picture here, the 17-year-old from New York City, who died from EVALI after vaping nicotine and THC oil for only about 6 months. Now, the teenager in the bottom photo, who's also 17 years old, had also vaped nicotine as well as THC oil for around the same time, about 6 months, and had damaged his lungs so severely that he required a double lung transplant just to survive. Now, the CDC was monitoring this EVALI outbreak very closely until around February of 2020, when they stopped tracking these cases and had to pivot to track COVID cases. The CDC discovered that about 80% of the cases involved THC oil and nicotine being vaped, while only about 20% of the cases involved strictly nicotine being vaped. Turns out that drug dealers and some legal marijuana companies we're using a chemical called vitamin E acetate to dilute the THC oil. And this added ingredient was causing a majority of the EVALI hospitalizations and deaths. Now, an important detail to share here is that inside all e-liquid in vape devices, it's composed of several chemicals that are approved by the FDA as safe for human consumption. And what that really means is it's safe to eat, such as propylene glycol, vegetable glycerin, and the many different types of food flavoring chemicals that are being used by the vape companies. Now, these chemicals were never approved as safe for human inhalation, and that research is being conducted currently. And the findings are alarmingly showing that many of these food flavoring chemicals are actually very harmful when inhaled. Vitamin E is a great example of a chemical that's approved by the FDA as safe to eat, but has also shown it's deadly when inhaled. As you can see on the map, every state had EVALI cases, including Hawaii, including the Big Island. The states in dark red are where deaths occurred, and I believe the youngest death was a 15-year-old teenager from Texas. So as the CDC really started zeroing in on COVID cases in 2020, it actually became apparent to many of us that follow the news around vaping that EVALI didn't disappear. Cases continued to make the news in 2020. Here's a 17-year-old from California who's actually, they thought he had COVID, but it turns out it was an EVALI case. Okay. In June 2021, there was a 21-year-old Kentucky college student whose case made the news. And just last week, there was an 18-year-old from Tennessee who ended up on a ventilator from EVALI. So the last story that I just want to share is from October 2021, last year. And there's also a study done by Johns Hopkins University researchers. So the team of researchers examined the full range of chemicals that was present in 4 different types of e-liquid brands and the aerosol. And they actually found about 2,000 different chemicals, many of which were unidentified. Among the identifiable chemicals were caffeine, pesticides, and 2 known flavoring chemicals that are already linked to lung inflammation. So as the great vape debate rages on, we're seeing the number of harmful chemicals in vapes compared to combustible cigarettes is actually numerically lower, but it seems that the chemicals you expose yourself to by vaping are having similar effects on the heart and the lungs as combustible cigarettes. And in some cases, e-cigarette users are suffering more severe illness at a younger age than cigarette smokers. So now I'd like to pass it off to Hawaii Public Health Institute's Policy Director, Amanda Fernandez, to provide some possible regulatory solutions to end the youth vaping epidemic.
Hi, everyone. Thank you so much for inviting me here today, and thank you to the rest of the other presenters, many of whom I am very blessed to call colleagues. I'm Amanda Fernandez. I'm the Policy and Advocacy Director with Hawaii Public Health Institute. We work a lot in policy and advocacy spaces, and we convene a statewide coalition for Tobacco-Free Hawai'i. So we get a bunch of groups together, a bunch of individual advocates, state agencies, nonprofit organizations, and we come up with solutions, and many of them guided by our very awesome youth council that can really make change to address the needs that have been discussed by the previous presenters. So I wanted to share with you today a little bit about some of the 2 of the priorities for this legislative session. As many of you may know, legislative session, at the Hawaii State Legislature runs from the 3rd Wednesday in every January, usually until in early May. And the typical process of how a bill becomes a law mirrors a lot of how it does at the city and county level, and then also at the federal level. Bills are referred to different committees. So when I talk today about what committee a bill is going to next, that's what I'm talking about. It's a subject matter committee that's going to consider the merits of the bill under the purview of that committee and decide whether they want to vote to pass it out so that it can be considered by the full chamber, so by the full House or the full Senate. Once it does that in both the House and the Senate, then it gets sent to the governor. So in 2022, we adopted many of the same priorities as we had in previous years, because unfortunately 2021 came with no increased regulation of e-cigarettes. And because for all the reasons that Josh and Sally and Kevin have discussed, we really felt that tackling the youth vaping epidemic was of utmost importance in Hawaii, particularly because of the high rate of youth vaping in both high schools and middle schools in our state. But also, it's not just about the flavor. We talk a lot about the flavors and the flavors being really attractive to kids, and that's absolutely true. But what's really necessary to enact the change that we want to see to really to stop this epidemic in its tracks is a comprehensive regulatory infrastructure on e-cigarettes. I bet a lot of people wouldn't realize that e-cigarettes are not taxed like other tobacco products in Hawaii. And they are highly unregulated. There's not the same licensing and permitting infrastructure as you might expect in selling something that's so highly addictive. But we also do want to end the sale of all flavored tobacco products. And it's important to include not just e-cigarettes, but also menthol cigarettes and flavored little cigars and chewing tobacco and things like that. Let me go back. So the two priorities are not only regulating e-cigarettes through tax parity with other tobacco products, creating that infrastructure for licensing and retailing and limiting online sales, because as Joshua showed, it's very easy to just purchase these products online. You just have to click a button saying that you're 21 and up. And then second, we want to end the sale of flavored tobacco products. Both of these were translated into bills. And for those of you who haven't worked at the state legislature before, either just as an individual advocate or through your job, it's actually a pretty accessible process if you want to have a bill introduced. So if you have a good idea, you can contact your local lawmaker and make that into a reality. So even if you have no legislative drafting experience, you can always reach out to them and talk to them about, putting your solution into a bill that can be introduced in the next session. So to talk through a little bit more in detail about our two priorities, this is our bill that we're seeing moving forward. It's Senate Bill 2278 on the regulatory framework side. And it's already gotten through, it's technically two committees, but it's a single committee referral. That distinction isn't super important to our conversation, but it has made it out of its first committee hearing, and it just needs to be heard in one more committee in the Senate before it can go and be considered in the House. And this, as I stated, creates tax parity between e-cigarettes and other tobacco products, requires licensing and permitting for sellers, and restricts online sales to licensed sellers only. So it can't be shipped directly to consumers like you or me. It would only be able to be shipped to licensed sellers. On the flavor side of things, we have two bills that are moving, one in the Senate and one in the House. And one has already passed out of its final committee in the Senate, and one it's making its way to its final committee in the House tomorrow. So I want to go a little bit over some of the changes that were made to the bills. So when they come up in hearing, what might be being referenced. In the Senate version, a previous version of the bill had excluded combustible cigarettes, little cigars, and chewing tobacco from the bill, so from the purview of the new law. So you wouldn't be able to have to sell flavored tobacco products but it would really only apply to e-cigarettes. It wouldn't apply to combustible cigarettes, little cigars, or chewing tobacco. That language actually was put back in by the previous committee, but I wanted to highlight it in green so you can see what was previously taken out and what was put back in. So it's actually in very good shape right now. On the House side, it still ends the sale of all flavors, including the sale of flavored combustible cigarettes, little cigars, chewing tobacco, and e-cigarettes. And it includes menthol, but it was amended in the earlier committee to create a lot of burdensome enforcement requirements. And why I bring this up is because they're the type of amendments that might sound really good to most people. Like, yeah, enforcement's great, transparency is great, but when you actually start looking into them, the hurdles that they would create make it so they would be very difficult, if not impossible, to enforce. And we want to make sure that we're balancing, impact and good policy, but also feasibility of implementation. A bill that passes without enforcement is toothless, but a bill that passes with such arduous enforcement requirements that it can't be done is also meaningless because it can't be put into effect. So if any of these sound like, either of these bills sound like things that you would like to be involved in, there are a lot of ways to get involved. And of course, the most obvious way is weighing in on the actual bills themselves. You can do that just by submitting written testimony, or you can also sign up to testify over Zoom at the actual hearing. But there's a lot of other ways as well, if that's not your thing. There are letters, you can write letters to the editor, write op-eds, emails to legislators. You can connect legislators to people who have really good stories. And we always need parent voices and student voices especially. It's really powerful thing. I can talk until I'm blue in the face at these hearings, but I think legislators really want to hear from their constituents. So you have a lot of power in this. And you can share things on social media if that's what you're most comfortable with, and give us a heads up, and HIPHI will try to reshare it. So we want to just get the word out there. And you have a lot of questions about the legislative process in general, where your bill is at, and you shouldn't be embarrassed to ask. But if you don't want to ask me, you always can. But if you don't want to ask me, I would visit the LRB or the PAR website, and that's the public access room at the Capitol. They're very nice. They always answer the phone, and their website has a lot of really helpful information. Even if you call and ask them, where is this bill? Like, what's happening next? They're going to give you an answer, and they're going to get back to you that day. So they're really helpful, and I can't say enough nice things about them. We also do action alerts on the HIPHI website. So if you are interested in learning more about these bills and upcoming hearings, please go to act.hiphi.org and you can sign up.
Thank you so much, Amanda. That's a lot of information there and a lot of things to follow and track at the ledge. So that's wonderful that you're keeping that on tabs and share that information with us. Thank you for that presentation there. I'd like to welcome back in Sally and now Lori Ching to really talk about some of the resources that are available for our families and even for our keiki that are experiencing some of the hardships with an addiction with vaping and e-cigarettes here. So Sally and Lori, I'll pass it back over to you. We can kind of go back and forth between the two of you if you'd like to share that here.
Sure. Lori, I'll let you start.
Okay, thank you, Sally. So when our principal came to me and said, I need some help, we need to get the word out about the dangers of vaping to our families and just our concern, I immediately went to the professionals. So I'm just so grateful for the Hawaii Public Health Institute collaboration here. So thank you very much. As a counselor intern, I think this year I have seen an increase of students coming in for counseling who are vaping and who are struggling with vaping. And I'm still putting together what kinds of resources are out there for them. Usually the first thing is, I tell the parents, talk to your pediatrician. But now I'm learning there's other resources, which I'm really glad, and I'm sure Sally's going to touch upon some of them. One that I know of is My Life, My Quit. And that's a really good resource. And in fact, that's how I think I found the Hawaii Public Health Institute. Most of the kids who come in for counseling who are vaping, when I ask them the reasons that they do, majority of them say, like Sally said, it is stress. They're like, Miss, it's just to deal with what's going on in my life. And Josh made a very good point that it's important that we don't penalize our youth, but we need to help them. We really do. And so I'm glad for tonight. So Sally, I'm going to hand it over to you.
Thank you, Lori. And I agree. You know, the resources that Lori shared, I think is the first place to start, especially for our youth. If the Hawaii State Quit Line has a youth line, and what's nice, they are coached to work with youth, and they do texting as well as voice coaching. They don't offer nicotine replacement therapy, but they definitely do offer coaching to help youth quit. So all you have to do is actually text Start My Quit, and the number is 36072 to 36072, and you type in Start My Quit, and you will be connected to the quit line for youth. The age group is about age 13 and older, but youth don't have to, you know, ask parents. I mean, a lot of youth don't want to tell their parents that they're vaping. They're definitely hiding the products, and but they want to stop. They feel the effects of it already. And it's something that Kevin alluded to as well in his presentation. We never saw this as public health professionals, and I used to run the American Lung Association, the immediate health effects that we see on youth today with traditional cigarettes. So their experience, and even from Waimea community, I have stories from physicians about youth coughing up a portion of their lung already, and they'd been vaping for a few months. So it's definitely an immediate effect. Also, parents can visit hawaiiinovape.com for resources. And I just, one of my personal favorites, because of the creator and the content, is 808novape.org. And that's a website with tremendous amounts of materials for families. It's a great place to have a conversation. There's videos from youth to talk to other youth about not vaping, but there's also a lot of videos, and we used to talk about before EVALI was these devices explode. And so there's videos on there showing what mods do and the dangerous. And there's one thing right now, just to know, the FDA does not regulate these devices. So we don't have any body, you know, that's saying, okay, this is a safe device. These whatever chemicals are in the devices is purely from the industry, and we don't have any regulations. So.
Thank you, Sally. Anything else, Lori, did you want to add on there?
Maybe I'd like to add one thing I usually encourage parents is to talk to your kids about this, that it's okay to talk to them and be very patient and ready to listen. Instead of, you know, asking, are you vaping? Are you using e-cigarettes? It's more like, hey, what do you know about vaping? Some of your friends doing it at school, and just listen. Ask them what's going on with their lives. Lots of the kids say that they, like, no one listens to them, and they just really need to be listened to. So that's an advice that I usually give parents. And if you find out that your child is vaping, stay calm. Be calm.
That's great of a story, and I wanted to share that, especially when we do presentations with younger youth. I always want them to identify with what relieves stress, what gives them joy. And maybe you start the conversation on is like, how do you deal with stress? And do you want to share any, you know, tools that you have? Because if we can identify healthy behaviors, we can help our kids go towards that when they need to tap into them.
Thank you, Sally. Thank you, Lori. Good information there. You know, we're kind of moving towards the end of tonight's meeting, and we have a couple questions from our community members, ones that have been submitted ahead of time, as I said, and ones that have been in the chat. So we'll try and gather those as well and share them with our guests here. I'm going to pop it out to kind of our gallery view so we can see all of our presenters here on tonight. And Janice, if you want to jump in here too and throw a few questions at our guests tonight too, you're more than welcome. I'm going to start pulling some questions out here, and then feel free. So for the next 10, 12 minutes here, we can pop back and forth and answer some of these questions from the community. And please understand that some of these questions may have been answered already, but I think it's good to revisit some of these and capture the essence of some of what these questions are asking, and even to reiterate some of those points. So I appreciate your patience with that. All right, so really first question I have is, and feel free, anyone can jump in on this, is really where and how are kids and students getting these items?
I can start with that from what I know on the Big Island, and then Kevin, you might want to be able to speak on this as well. Locally, kids are getting them a lot of times from family members, from other students. I was just on a phone call yesterday with a principal in an East Hawaii Middle School that they know of parents that are providing them to their student that is selling them on campus. And I've heard that many times from many different schools on Hawaii Island. As Josh shared earlier, being the non-regulation of the online sales, all you have to do is click a button and say you're over the age of 21. And if you have a debit card, you can purchase devices. So, and then I haven't heard it in the last year or so, but in the past, we've had youth council members share with us that they've been able to walk to stores with their friends that are honor students, and they were able to purchase them without being carded. So we may have retailers that still sell to underage youth. So there's a wide variety of access right now.
Thank you, Sally. And kind of branching off that a little bit, shouldn't it be cost prohibitive for our keiki and students? Aren't these expensive items?
I wish it was. They used to be. The vape devices back in 2018 were fairly expensive. So when they were confiscated, parents actually got really upset because they were so expensive, and they'd insist that the principals give them back. But fortunately, the law states that they can't have them back. But now they onboard at a really, really low rate. And I don't share this with students in my presentations, but with our parents, I'll let them know. If you can go to various websites, and they're 99 cents for a starter kit. So they're very easy to onboard at a very low rate.
Oh, okay. A question that came in online was about, they loved your slides, and they wanted to see if that was a usable resource for them, and if that could be made available at some point somehow.
Yes, I don't think there is a problem with being able to share our slides, and then we'll circle back to the youth council to confirm if we can share Josh's slides as well, but we'd be happy to get that information out to your viewers.
Perfect. Thank you so much. And then, it was touched on a little bit about, you had I believe it was Kevin, you had this amazing story, and really a heartbreaking story about a student had a full ride scholarship, sports, and lost that because of his Instagram and social media posts. And so kind of launching off that a little bit is, why can't students do sports and vaping? What's happening? What's affecting their body? What's going on in that situation?
I think that was your story, Sally.
Okay, sorry about that. Yes.
No worries.
But Kevin, please feel free to share. Kevin has a wealth of knowledge about, lung health issues. But what we're hearing firsthand from students, I actually have a stack of testimony behind me from Waikea High School, and many of them were student athletes, talking about the decreased physical abilities they have since they started vaping, and the impairment it has with the cells and the alveoli and being able to exchange oxygen. But Kevin, if you want to expand, please feel free.
I'll just fall back on the one example that I showed in the two pictures of the 17-year-olds, the one from New York City that died, the one that needed a double lung transplant. There's a picture of him actually running. He used to be a long distance runner. His dream was to be a Navy SEAL. And his lungs were so damaged from vaping, the combination of nicotine vapes he started, and then and then moved on to starting to vape THC oil, and then both rotating them for 6 months. After his lung transplant, he couldn't walk up a flight of stairs, and he probably will never be able to run a mile in his life. I mean, he takes 20 medications. His life expectancy is about 7 years. So that's an extreme case. But there's lots of cases that I've heard anecdotal from student athletes that, you know, were hooked on vaping for 6 months to a year, and just noticed that they just didn't have the stamina to run back and forth on the soccer field or back and forth on the basketball court like they used to. And that was one of the motivations for them to quit. And I never heard back if they were able to quit and if their athletic ability returned. But that's something that should be of concern to any high school or even middle school students that really value athletics and get caught up in this youth vaping epidemic.
Thank you, Kevin. You know, and if we look at our keiki and we look at our families and our children, what are some of these symptoms that we're seeing from their vaping use or nicotine addiction? What are we looking at if they come home, and what do we see that's afflicting them typically?
I'll start. I'm sure Kevin can fill in the list. Irritability, withdrawal from normal behavior. We're seeing even significant like grades dropping and just not wanting to be involved, hiding things, staying away from family. These are just some of the typical behaviors before you even probably see physical changes for youth when they're starting to vape.
A couple other things to look for: increased thirst. You know, smoking and vaping just makes you parched, dry mouth, dry nose, nosebleeds, just dryness in that whole upper respiratory tract. If it smells like gummy bears in your kid's room, or cotton candy or chocolate chip cookies in their room, and they're not baking chocolate chip cookies, that's definitely something to be mindful of. Moody and irritability, Sally already said that. So it can be tough. You know, I have an 18-year-old high school senior of my own that is always moody and irritable. I'm pretty sure though that he's not vaping. Check his dresser. He knows the type of work I do. He has asthma, so it would be pretty clear to me if he was vaping, he'd probably have increased respiratory issues happening right now. But those are some things to look out for.
Yes, Janice.
So I would say concentration. The need to have the vape control of it overrides the reason to be at school. And I think the social aspect of it is really a big influence on the middle school campus.
Thank you, Janice, for the insight there, what you're seeing on the school. All right, let's jump to a different one. Something that we kind of hear often is this term about popcorn lung. Could you explain a little bit about, you know, what popcorn lung is? I know we saw some pictures and we saw some effects of it. If you could really talk about how that terminology got associated.
Sally, you want that, or you want me to go ahead? Okay.
You can take.
So popcorn lung is the name of the condition. It's an irreversible and potentially fatal lung condition. Is called bronchiolitis obliterans. So that's kind of a tricky Harry Potter kind of phrase that it's easier to say popcorn lung. But the reason that they call it popcorn lung is because in the mid 1980s, there were workers that were working in popcorn factory, right? So part of my presentation, I mentioned ingredients, food flavoring ingredients that are approved by the FDA that are safe to eat, but unsafe to inhale. So there's a particularly food flavoring chemical called diacetyl that is actually used to flavor popcorn, butter flavored microwave popcorn. So if you've ever eaten microwave butter flavored popcorn, you've probably eaten diacetyl, but don't panic because eating it is okay. But the workers that were inhaling this came down with the lung disease. Okay? And then they ended up suing the the popcorn companies and got these pretty large class action lawsuit payouts of $20-30 million. And again, this was in the 90s now when the litigation finally panned out. And then I think in about 2015, e-cigarettes came out in the market in 2007, so they're relatively new. In 2015, a few scientific studies looking at the ingredients of e-cigarette or e-liquids actually found that a couple of companies were using diacetyl, food flavoring chemical, that caused the lung disease in these workers that were inhaling those fumes. Companies were using it to flavor e-liquid flavor profiles that were like buttered popcorn or any type of muffin or type of baked good flavor profile could be potentially have diacetyl in it. And what actually happens is inside your lungs, you have these tubes that transport oxygen and carbon dioxide every time we breathe. Those tubes are called bronchi. So bronchitis is a condition of those larger tubes. As those tubes get narrow towards the outside of the lung, they get much smaller, much more narrow, much more delicate, and they're called bronchioles. So if you actually cut a bronchiole in half and looked in it, it would look like a straw or a pipe, right? It's nice and clear. What happens with diacetyl and what actually they're finding out some other food flavoring chemicals like cherry, cinnamon, vanilla, chocolate, really the food flavoring profiles are really what the scientists are looking at, are contributing to this inflammation of the inner lining of the bronchiole called the epithelium. So these epithelial cells, every time they're exposed to certain chemicals, those cells are dying. But a good example of how miraculous the human body is, if you get a cut on your hand or your finger, you put a Band-Aid on it, 2 days later, you pull it off and your skin has regenerated itself. So the lungs regenerate a new layer of epithelial cells on top of those dead ones. But when people are addicted to these products, they continue to use them. So what happens is a cycle of new epithelium dies, another layer gets put on, dies, another layer dies. So over years, that builds up as scar tissue. So a previously healthy, normal bronchiole that's clear like a tube or a straw, after 15 years of this chemical exposure, sometimes less, sometimes longer, all that inner lining is filled with scar tissue, leaving a very little slit for oxygen to come in and carbon dioxide to go out. So someone with that type of condition would need a lung transplant, lung surgery, or possibly if it's irreversible and untreatable, they might need to carry around an oxygen tank with them just to breathe normally. Sorry for the long answer.
No, that's great, Kevin. That's wonderful information there and very detailed. I'd like to really throw a question here at Amanda, if possible. Maybe she can jump in on this one here. Really talking, you presented us some of the policy side of things, and maybe you could jump in about some of the other legality issues around vaping. And I'll start off, I'll kind of join these two here about how do we make it, they're very kid friendly. How do we make them, stop being as accessible to our keiki? And how do we even prevent it from being sold online?
So you would create an offense of, you would make it illegal to ship these products directly to consumers. So anybody except a licensed retailer here in Hawaii. That's how you would make it so you can't sell them online. And there would need to be some enforcement around that, but it's really the comprehensive regulations that I talked about. So creating tax parity, I believe, I forget which presenter had mentioned how price sensitive youth tend to be. And that's what we've learned from combustible cigarettes, right? We have a lot of research on that. And that's one of the best ways to decrease consumption of tobacco in youth is to make it more expensive. And it's also one of the most equitable ways of going about things. And so creating that tax parity, so we're taxing them just like we tax other tobacco products, which makes complete sense, right? And then really ending the sale of flavored tobacco products. So any tobacco products you are able to sell in Hawaii, they can't have any sort of flavoring in them.
So really to jump a little bit further here, why doesn't our ledge regulate the flavor of sales, these flavor sales basically? What's going on there?
That's a really good question. And I mean, it's not an easy answer. I think that it's easy to look at the thousands and thousands and thousands of dollars that so many legislators have received from big tobacco companies over the years and political campaign donations, and say like, well, that's why. But it's also a lot of lateral peer pressure. And so the feeling, this sentiment that's not founded in truth, that these things can't move, but they absolutely can. And when we come up against political resistance to that, and the best way, the only way really we're going to overcome that is with people power, is with people reaching out with their stories. Because if you're being told no by a legislator, they can't do this, you say, okay, thank you for your input. And then you show up again at the next neighborhood board meeting or the next community association meeting that legislator is joining, or their next neighborhood town hall, right? So, and ask them again the same question. And it's really about putting that public pressure on our elected officials. I want to say that reapportionment is happening. So everyone is up for re-election this year. This is one of the most powerful times to make your voice heard. Like you have so much power this year because everyone wants your vote.
And lastly, if I'd like to piggyback on that, we have to do this at the state level. Before 2018, we used to regulate tobacco products, either secondhand smoke or even the sale of products at the county level. And we've had tremendous success at the county level. But in 2018, there was a clause put in a bill that stated that sales could not be regulated at the county level. We can't do any laws here in Hawaii County. So we really need our families to participate at the state level and let their voices be heard.
I know we're running up against time, but I do want to circle back real fast and say that I definitely believe that tobacco money has played a significant role in influencing legislators' resistance to passing reform or comprehensive regulations in this area. I don't think that every legislator who is resisting this, is in the pocket of big tobacco, but that is definitely an industry tactic that we know so well, decades in, right? This has been going on forever.
Thank you, Amanda. Thank you, Sally. Yeah, we are kind of coming to the end here for tonight's forum, but I wanted to pass it back to Janice if you wanted to share any last sort of insight here, and Lori kind of at the school level here, particularly in Waimea.
I learned a lot this evening. It wasn't something that I expected to learn, but I learned a lot. And I really appreciate having Josh here, because I think that student voice is super important. And I expect to see great things from Josh in the future, because I think he can bring it back to Hawaii and explain the continental experiences, and then how we work locally with families and friends.
Thank you, Janice. We have some other questions, of course, but this is really a great starter conversation, and continuing this conversation about vaping and for our keiki in our communities and the impacts it's having. You've heard a wealth of knowledge here, and they have a lot more to share too. So if you ever want to reach out to the Hawaii Public Health Institute and our team here, even at Waimea Middle School with Janice and Lori Ching. We had a great presentation by Josh early at the top of the meeting. So it was really wonderful to have you all on here with us this evening and really share your mana'o with the community, and really connect on some of these really hard-hitting questions about what's impacting our keiki. Kevin, did you have something else you wanted to add there? No. All right. Sorry. I just saw you go turn your mic on. So I wanted to offer you opportunity, of course. This forum is available up on the Waimea Community Association website, the Facebook page, as well as the Waimea Middle School Facebook page. And then this is also being recorded for us to share out on other platforms as well. Once again, I'm grateful to have Janice English, Principal of Waimea Middle School, Lori Ching, our counselor at Waimea Middle School, as well as our Hawaii Public Health Institute team with Sally Anchetta, Kevin Ramirez, and Amanda Fernandez, and of course, Josh Ching. And we wish him all the best as he moves on to the next stage in his life. But it was wonderful to have his perspective here this evening and share his mana'o. Thanks everyone for joining us this evening. Wish you all the best. Aloha, be well. Have a good night. Thank you so much.
Thank you.